Hello guys, today we will learn about management options for type 2 diabetes and counseling points. This is PowerPoint presentation. So, what is diabetes? Yeah, diabetes is a group of metabolic disorders characterized and identified by the presence of hyperglycemia when there is no drug treatment, which means the blood sugar level is very high if you don't use drug. So, according to 2017 and 2018 national survey, a total of 1.2 million Australians were diagnosed with diabetes, which is 4.9% of whole population. Among these, 1 million people had type 2 diabetes, and 145,000 people had type 1 diabetes. And also, GDM affected approximately 15% of pregnant women. So we can just divide diabetes into three different categories. So, type 1 diabetes is a autoimmune disorder that results in destruction of beta cell, and therefore it causes insulin deficiency, which is like 0.8% of whole Australian population, and it is less common than type 2 diabetes. And type 2 diabetes, it is really common one, and this happens because insulin is not secreting enough because of background insulin resistance. So often, people who eat a lot of donuts or chocolate or juice can have type 2 diabetes. It is their risk factor. Also, being obese, having a poor diet, and not moving enough body also can lead to type 2 diabetes. Also, there's another diabetes called GDM, which stands for gestational diabetes mellitus. It usually happens in the first trimester of pregnancy or during pregnancy, and it happens in 15% of pregnant women. So why are diabetes bad? So when diabetes happens, the blood sugar level is higher than normal people. Therefore, it is causing hyperglycemia. When the blood sugar level is high, it can affect many cells in a harmful way, especially pancreatic beta cells or neuronal cells or vascular endothelial cells. So when people are having diabetes, it is 3 to 4 times more to suffer from myocardial infarction, stroke, or kidney failure. And it 15 times more rate of amputation, which is surgically cutting off a limb, like hand or foot cut off. Yeah, it is also leading cause of preventative blindness. So when people are having diabetes, their neuron in the eyes are getting hard. Therefore, it can cause to blindness. The diabetes is really causing a lot of money. $2.5 billion a year alone is spent from Australian government to help people manage with diabetes. It is really a lot. When you compare diabetes with other diseases such as heart disease is serious. It's like so many people have problems, but it is $2 billion per annual. Still less than diabetes. And chronic kidney disease is $1.7 billion, which is still less than diabetes. And stroke is much less than diabetes. So diabetes is really serious. Yep. So let's check out because you guys are all pharmacy staffs, you guys already know this, but maybe you guys have forgot about this. So let's have a time to revise. So this is this shows the guidelines for diabetes. As you can see, first line is metformin. However, if metformin doesn't manage diabetes well, you can do the dual therapy, which can be a SGLT2 inhibitor, which is dapagliflozin or empagliflozin, or you can have a GLP-1 analog, such as injections like Ozempic injection, or you can have insulin. So this dual therapy can be used in diabetes when metformin alone does not manage diabetes well. So it can be added as a adjunct therapy. So this is the table that we use. Is from ETG, the therapeutic guideline. And the diagnosis of type 2 diabetes. Firstly, people should have a lifestyle modification, such as reducing chocolate or reducing cake or donut. They should exercise more. They shouldn't just, sit down in their room for the whole day. They have to go outside, walk in nature. And then, however, even though you change your lifestyle and even though you still have diabetes, if HbA1c level is less than 69 millimole per mole, which is 8.5%, you can start metformin immediately. Usually metformin every day, like 500 milligram. The dose can be different, but yeah, just do it for 3 months. And if the glycemic target is not achieved, then you should consider a second drug. The second drugs are usually like SGLT2 inhibitor or sulfonylurea or DPP4 inhibitor. Or you can use insulin injection or GLP-1 analog agonist. Yep. So just for the summary, if you have a cardiovascular disease or risk of heart disease or CVD, you can consider SGLT2 inhibitor or GLP-1 agonist. First of all, I would like to introduce you guys metformin. Of course, because you are pharmacy staff members, you have seen this a lot. This is not an actual counseling. This is just for preparing the OSCE exam. So I'll just pretend as if I'm talking to patient. Hello, this is metformin. This medication is to manage your diabetes. Please take 1 tablet twice a day, with or soon after food. So by taking this metformin with food, it will reduce your stomach upset. While you are taking this, please avoid alcohol drinking, because drinking alcohol can affect your diabetes and increase the risk of side effects, so try to take as minimum drink as possible. Side effects is that it is rare, but for more than 1% of the population, the nausea and vomiting and diarrhea can happen. Also, if you develop a rash, yellowing of the skin, or swelling of the lips or face, please stop the medication and tell doctor immediately. So to manage diabetes, it may take up to 2 weeks to establish the onset. Please remember there are like non-pharma management, so please move your body a lot, please do some exercise, and eat less sugar food such as chocolate or juice. Yep. So yeah, this was counseling points. And as you can see, there are some mechanism is that metformin reduces hepatic insulin resistance and increase insulin sensitivity in peripheral tissues. Hypoglycemia effect is rare. So even though you take metformin, it does not cause you hypoglycemia. The effect on weight is kind of neutral or to decrease a little bit. The good thing is it does not increase the weight. Common side effects are diarrhea, decrease of appetite, and it is less common, but it can also cause metallic taste or vitamin B12 deficiency. So metformin was first marketed in France. It's just for the background, but in 1957, but still remains the global first-line therapy for type 2 diabetes because it is cheap, it produces consistent glycemic control, it does not increase weight, and it is have a safe profile for a majority of people. The end of metformin. Let's go to the next group. Next group is SGLT2 inhibitor. Yep. So this group of medicines include empagliflozin or dapagliflozin. It comes as a single medication, or sometimes it is mixed with other medication and supplied as a combination therapy. So for dapagliflozin, the brand name can be Forxiga in Australia. And for empagliflozin, the brand name can be Jardiance. So how does SGLT2 inhibitor works? How does this Jardiance and Forxiga works? So the mechanism is that it blocks the sodium glucose cotransporter 2, and it reduces the glucose resorption in the kidney and increasing its excretion in urine. So the thing is, the blood sugar goes to urine and more urine goes out. So this is why when you are using SGLT2 inhibitor, there will be sugar in urine and you will urinate much more frequently. So just for the counseling points, again, I'll pretend like I am talking to a patient. Just for example, just for oral exam. Hello, this medication is called Jardiance, and it is to manage your type 2 diabetes. Please take 1 tablet once a day. This can be taken with or without food. So how it works is that it increases sugar excretion in urine. So just be aware that there will be glucose increase in your urine if you just take a test, but it does not mean that diabetes is not controlled. Diabetes will be managed with this medication, but it's just that the blood sugar will be included in urine. So for the side effects, this Jardiance can increase your frequency of urination. So you will urinate more. So please drink sufficient amount of water to avoid dehydration. Side effects can be increased thirst because you are urinating more, constipation because you are urinating more. For allergies, if you develop a rash, swelling of the face, or yellowing of the skin, please stop the medication and tell your doctor immediately. Yep, so this was the counseling points of empagliflozin. And next, we'll talk about Ozempic. So Ozempic is called GLP-1 agonist, and as you guys have seen this enough, a lot. Yeah, this is very popular medication. Why is it so popular? Because it is also beneficial for preventing cardiovascular diseases. Ozempic makes people lose weight, and there is a little risk of hypoglycemia. When you are using Ozempic, myocardial infarction, stroke, this risk has significantly reduced. And also it is a once weekly dose, so that's why people want to use it. Some other injections, there's like a once daily injection or twice daily injection, and it's so much. But Ozempic is just once a week. So again, just some counseling points. I'll pretend as if I'm talking to a patient. Hello, this medication is called Ozempic. This is once weekly injection. Before you open the box, you can keep this in the fridge, but once you open it, it can stay in the room temperature for 6 weeks. You have to prime it first before using it. You just have to prime it once, one pen, and one pen has 6 shots, 6 weeks. Inject on thigh or abdomen or upper arm, and then press button for 6 seconds. Starting dose is 0.25 milligram a week. Please maintain this dose for 4 weeks, and after 4 weeks, you can increase it to 0.5 milligram weekly as directed by your doctor. Please use it on the same day. So for example, if you give yourself injection on Monday, wait 7 days and give yourself injection next Monday. You may feel nauseous or vomiting feeling in the beginning, but as time passes, there will be less discomfort. Also, when you're injecting this, you must throw away the needles. There are 6 needles in the box, and whenever you are giving yourself, use new one. Don't use it again. Just throw it away after you use it. And do not share needles with other people, because if you do that, kind of like infection might happen, contamination might happen. So if you feel nauseous, which happen to 50% of patients, if you reduce food intake, it may reduce the uncomfortable feeling. Improvements with glucose may take time if you are using Ozempic, so please be patient and wait 2 to 4 weeks to see the effect. Thank you. Yep, so these were the counseling points for several medications that were used in type 2 diabetes. I hope you guys enjoyed it. I hope some of the knowledges that you learned in the past come back to your memory. Yeah, thank you. Bye. Thanks for listening.